every 11 seconds. Till girl is mutilated somewhere in the world.
Female genital mutilation, also known as FGM, is a medically unnecessary and painful practice of deliberately damaging the female genitalia. It is a procedure practiced in over 28 African countries, as well as in other parts of the world, such as Asia and the Middle East. Approximately 140 million women today have been circumcised, usually between the ages of 4 and 14. The procedure involves the cutting of the external female sex organ, generally using unsanitary tools such as rocks, razor blades, and knives. Typically, it is performed without anesthesia, and the girls are held down or otherwise restricted by the practitioners. This inhumane practice has no health benefits and does not have any major religious justifications. However, women often consent to the procedure due to social and economic pressures.
It is believed that female genitals are unhygienic and impure. Common views on female genitals are that they are ugly and will grow to be unwieldy if not cut back or sewn up. It is also believed that FGM can improve fertility and can prevent infant mortality during birth. In addition, sewing or otherwise shutting the vaginal opening safeguards female virginity, which ensures that the woman is pure.
Uncircumcised women cannot marry and do not have a high social status in tribes that practice FGM. Circumcision increases sexual pleasure for the men as they no longer have to worry about the woman's needs. In addition, the removal of sexual pleasure for females increases their value on the marriage market as husbands do not have to supervise their wives as much since adultery is less likely. Therefore, couples can ensure that their kids are their own. There is a heavy social pressure on parents to have FGM performed on their children, as it is supposedly crucial in raising proper children. Performing FGM on children and wives increases and ensures status of families and women as well, and women who refuse circumcision are looked down upon in society. Though no major religions like Islam or Christianity condone the practice of female circumcision, many practitioners use religion as justification.
FGM is defined as the partial or total removal of the female genitalia or any form of intentional injury to the female genital organs for no medical reason. There are 4 classifications of FGM. Type 1, the clitoridectomy, is the partial or total removal of the clitoris and or the prepuce. 80 to 90% of all circumcisions are of this type. The second type, excision, is the partial or total removal of the clitoris and the labia minora, with or without excision of the labia majora. Type 3, infibulation, consists of the narrowing of the vaginal orifice with creation of a covering seal by cutting and appositioning the labia minora and or the labia majora, with or without excision of the clitoris. 10 to 15% of circumcisions are infibulations. Any other harmful practices are classified as type 4, such as pricking, piercing, incising, scraping, or cauterizing the female sex organs. For the most part, there is no sanitation or sterilization of materials, and a lack of trained medical professionals is rampant in countries in which FGM is prevalent. The recent medicalization of female circumcision by moving the process to a hospital setting is legitimizing the practice and encouraging it to be continued as a medical procedure.
High infertility rates result from circumcision, which contradicts the common belief that FGM increases fertility rates. Circumcised women often experience painful menstruation for the rest of their lives, in addition to difficulty urinating. FGM causes the sex organs to become permanently damaged, so they become more susceptible to tearing during sexual intercourse. Excessive bleeding due to improper wound closures can lead to death. Also, the chances for getting infections increases, many of which can lead to death. The resulting blood flow increases chances of STIs and HIV. However, the psychological effects of FGM are the most devastating. Women often experience trauma and shock during the procedure because they are held down and forced against their will.
The most effective approach is a non-coercive and non-judgmental one, with a primary focus as the fulfillment of human rights and the empowerment of women. FGM must be substituted with rituals that are not harmful to women, including community meetings, cross-generational conversations, male discussions, theater productions, songs, and community declarations. These activities increase the understanding between practitioners and victims, which will reduce the amount of circumcisions. Education is also a key aspect in combating FGM, as about 58% of uneducated women in the FGM rampant countries are circumcised. Laws protecting women must be placed and enforced.
It is very important that fighting FGM is a group effort, not just dependent on the will of developed countries to push undeveloped ones to take action. The awareness of the harm caused by the practice must be understood. Communities must explicitly agree to abandon FGM without plans of going back to the practice. Processes of organized diffusion of anti-FGM information are very important in encouraging communities to abandon the practice, and an environment that enables and supports change must be established. Let's stop this harmful procedure affecting thousands of women throughout the world.
Ijolebe natamba Yesu natambira bona ijolebe natamba